It's on.
We're going to demonstrate how to reconstitute and administer leptin to a patient with lipodystrophy. We're making the patient's medication that they're going to inject, so it's very important that we're as clean as possible. So the very first step is to wash your hands thoroughly before we prepare the medication. When you're washing your hands, you can either tell the patient in their head to sing the ABC song, or it's technically for 15 to 20 seconds that you need to wash your hands. And then have the patient, when they need to turn off the water, use a towel to turn off the faucet of the water. With each vial of leptin is going to come a vial of sterile water or bacteriostatic water. So you first remove the tops and whatever else is in your way that may prevent you from seeing the leptin. This is the leptin powder that needs to be reconstituted, and this is sterile water. Make sure that it's water, not saline. Make sure that you're injecting sterile water. Once the caps are removed of the vials, clean the rubber top with the alcohol swab. Then with your syringe, that's a 3 cc syringe, we're going to pull out the sterile water into this sterile syringe. Before you pull out the water, it's always important to put into the vial how much volume you're going to take out. And because it's always 2.2, we're going to put in 2.2 of air. Measure the water at the top of the black stopper to 2.2, which is 2 lines past 2. Now into the powdered leptin, we're going to add this sterile water very slowly. And I always tilt the vial so that the water's not directly going on top of the powdered leptin. It'll take at least 1 minute to put the water into the vial if you're doing it at the right speed. You don't want to see a stream of water coming out of the needle. You want to always see drops. If it's a stream like that, it's just too fast. But the drops can be fast. You just want to be able to see the drops. And the reason we're going to such care to add it slowly, you want to minimize making bubbles in the solution, because the bubbles can denature the protein, and the protein is the leptin. Continue to keep your thumb holding on the bottom of the plunger of the syringe and withdraw the needle. Then dispose of that needle how it's appropriate in the patient's municipality. There always will be a little bit of remaining powder leptin. You don't want to shake the vial. You just want to swirl it, and it'll probably take an additional minute for that powder to go into solution. Once it's in solution, it won't go back out of solution. It's almost out. You can still see a little bit. Always caution the patient, make sure they get every last bit of powder into solution. This will just guarantee the right concentration of leptin in the solution. And as you can see, there's very little bubbles, if any, in this solution because we're not shaking it vigorously. It's almost all into solution. Okay. Now, if they want to hold it up to the light, you'll see that there's no remaining powder in the vial. Because I've manipulated the vial, I recommend that they clean the top of the vial one more time. Then the patient will, now they're going to pull out their dose of leptin, whatever is prescribed. This prescription amount is 90 unit markings, or using this syringe volumetrically, it's 0.9 mLs. With the leptin vial, we don't need to add air into this vial, because if we added air into it, it actually creates bubbles. But for whatever reason, in the experience I've had, it's a glass vial and it doesn't seem to need air in it like the water one does. So we're just going to put the needle right in. Tell the patient be sure to have it go right in the center of the vial, because the rubber stopper's rather thick past the entrance of the vial, and their needle could just be stuck in the rubber and not be in the middle. Have the patient pull the syringe back and forth just a little bit, just to get the inner barrel of the syringe wet with the leptin, so that that'll minimize bubbles. Then they pull back the leptin slowly, because the needle's very fine. Again, you measure the amount looking at the top of the black rubber stopper. And this prescription dose for this patient is 0.9 mLs, or 90 unit markings on an insulin syringe. Instead of recapping the needle, I always recommend that patients just rest the syringe on top of a sterile alcohol swab. Prepare the site on the skin of the patient, then inject it. That way you're not recapping the needle.